Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog I shared long-term ventilation and tracheostomy in intensive care. Does patient care need to be reinvented? You can check out last week's blog by clicking on the link below this video. In this week's blog I want to share with you long-term ventilation with tracheostomy. Finally, a sustainable care model is emerging. It's no exaggeration to say that long-term ventilated adults and children with tracheostomies are costing taxpayers an arm and a leg. To put it more succinct, it's unsustainable to leave long-term ventilated adults and children with tracheostomies in intensive care. Evidence has shown that long-term ventilated adults and children with tracheostomies that also come under DRGs AO6A and AO6B are the second highest ranking DRGs only after LVAD insertion in Australia. The Australian Independent Hospital Pricing Authority, IHPA, has published statistics on the National Hospital Cost Data Collection, Australian Public Hospitals Cost Report, that DRGs AO6A and AO6B are the second highest ranking DRGs in Australian public hospital only after LVAD insertion. But that's only the tip of the iceberg. On top of that, the quality of life for long-term ventilated adults and children with tracheostomies in intensive care, as well as the quality of life for their families, is suffering big time. In fact, there is no quality of life in intensive care for long-term ventilated adults and children with tracheostomies, and there's no quality of life for their families as well. In fact, many families of long-term ICU patients put their lives on hold too, and often stop working, etc. This has a significant impact on their families on top of having a loved one in intensive care. And it's something that intensive care units are not particularly good at dealing with. The answer to this dilemma is simple. Continue treating long-term ventilated adults and children with tracheostomies at home with specialized services like ours, Intensive Care at Home. Reduce the massive costs, improve the quality of life for patients and for their families, and help intensive care units to free up their precious and in-demand ICU beds. Our service, Intensive Care at Home, provides a sustainable care model for long-term ventilated adults and children with tracheostomies. We are improving the quality of life for our clients and their families, and we are proactively helping public and private health services to reduce their massive expenses in intensive care. Our model of care is evidence-based and has shown to be effective with our clients, and it has shown to be effective in other first world countries for nearly 2 decades, mainly in Germany, Austria and Switzerland. For more information, you can contact me on 041 094 2230 or email me at patrick@intensivecareathome.com.au, or you can leave your comments on the blog. We also have exciting career opportunities for critical care trained nurses. We're hiring enthusiastic and experienced intensive care nurses with critical care certificate for our ventilated clients in Melbourne. We would also like to hear from you if you have a minimum of 2 years pediatric ICU experience, as we have opportunities there as well. For more information, check out our career section or contact me on 041 094 2230 or send me an email. You can also contact me if you want to know more about how we can help you, your intensive care units, your patients and your families, or if you are a family member of having a loved one in intensive care with long-term ventilation needs, contact us as well. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.